Okay, welcome back to the show.
Yep.
Okay, today is all about the men.
Yeah.
Yes, male infertility, which is quite broad. We'll try to delve as much as we can into this. But Dr. Senyo is here and Dr. Bernard Tobo is also here. He's a senior specialist urologist at the Kolebu Teaching Hospital.
Jigwe.
Good morning,
Yeah.
doctors.
Good morning.
Okay, so I think I'm just going to sit back and cross my legs.
Yeah.
And let you educate the men. But it's good for the women to pay attention as well.
Absolutely, they need
so
to
that
pay attention
you
so
also
you can
educate your
communicate to your husband. Yeah. So there's an insight on what infertility, male infertility is, and I'm sure two people, Ima and Okuto, would watch it closely. So let's take a look at that.
Okay.
Reproduction or making a baby is a simple and natural experience for most couples. However, for some couples, it is very difficult to conceive. A man's fertility generally relies on the quality and quantity of his sperm. If the number of sperm a man ejaculates is lower, or if the sperm are of a poor quality, it will be difficult and sometimes impossible for him to cause a pregnancy. Male infertility is diagnosed when, after testing both partners, reproductive problems have been found in the male. Infertility is a widespread problem. For about 1 in 5 infertile couple, the problem lies solely in the male partner. It is estimated that 1 in 20 men has some kind of fertility problem with low number of sperm in his ejaculate. However, only about 1 in every 100 men has no sperm in his ejaculate. In most cases, there are no obvious signs of infertility. Intercourse, erection, and ejaculation will usually happen without difficulty. The quantity and appearance of the ejaculated semen generally appears normal to the naked eye. About 2/3 of infertile men have a problem with making sperm in the testes. Either low numbers of sperm are made or the sperm that are made do not work properly. Sperm transport problems are found in about 1 in every 5 infertile men, including men who have had vasectomy but now wish to have more children. Blockages, often referred to as obstacles, in the tubes leading sperm away from the testes to the penis can cause a complete lack of sperm in the ejaculated sperm. Known causes of male infertility include sperm production problems, blockage of sperm transport, sexual problems, that is erection and ejaculation problems, and hormonal problems. Other less common causes of infertility include sexual problems that affect whether semen is able to enter the woman's vagina for fertilization to take place, and that is 1 in 100 infertile couples. Low levels of hormones made in the pituitary gland that act on the testes, that is 1 in 100 infertile men. The sperm antibodies, that is found in 1 in 16 infertile men. In most men, sperm antibodies will not affect the chance of a pregnancy, but in some men, sperm antibodies reduce fertility. Medical tests are needed to find out if a man is infertile. Male infertility is usually caused by problems that affect either sperm production or sperm transport. Through medical testing, the doctor may be able to find the cause of the problem.
Technology has come so far to help men who suffer from this. But again, Dr. Bernard, Dr. Senyo are here. They're the experts. They're going to teach us. Okay.
Yeah.
So we're quite sure you come across these cases quite a bit in your line of work. How easy is it for a man to accept the fact that he has a problem with infertility? Especially in our culture.
This is a lot.
Especially,
We do see a lot, the inset talked about 1 in 20, but sometimes you can get as maybe 1 in 10.
Yeah. Oh, wow.
Yes.
Wow.
An interesting thing is that most of the men may look okay.
Yes.
May look fine, may look well built, strong, but down there things are going wrong.
Right. So when we say male infertility, what do we mean by male infertility?
Well, generally, you need 2 people to tango,
Yes.
the male and the female, and the male contributes about 50% to the whole thing. So essentially, inability of a woman to conceive, mainly attributable to the man.
Okay.
So there are certain conditionalities. There should be regular, unprotected sex for a minimum of 12 months, yes. When we say regular, at least 3 times in a week.
Okay.
Yeah. And
That is for the married couple. Those who are married.
Well, for a couple.
For a couple. Maybe for a couple.
For a
Yeah.
couple.
Let's be
Not
real here.
necessarily,
Okay, so for instance, if maybe you've been having intercourse maybe once a week for about 3 months, you haven't conceived, you can't necessarily say you're infertile yet. You need to give it a bit more regularity or wait a bit longer.
Well, I'd like to touch on that. You see, the definitions are so made to guide people.
Yeah.
And so I tell people that, look, hey, if you've been in the situation for a year and you've met all these conditionalities and nothing has happened, you've qualified under that definition to be defined as infertile or subfertile.
Okay.
But if you had a problem, say you are getting married today or you're with somebody today and you have a problem that will not change with time.
Okay.
Even if you waited for a year or 2 years or 3 years, that problem will be there. Then there's no point in waiting. So when I get couples who come to me having married for 3 months and are worried that something could be wrong, you don't turn them away and say, go and do it for a year and come back. They are worth investigating.
Okay.
And that's so important in our practice.
Right.
So if you just say, go and wait for a year and they have a problem, which will not change within that year, then you have wasted your time.
Right, okay.
You understand?
So what are some of the conditions that will make it ideal for a man to produce like all the sperm, for the sperm to swim, to fertilize the egg and all those kind of...
All right.
What are some of the ideal conditions? What should
just
they
like
do?
to give you an overview
Right.
of what fertility, male fertility is. You see, the brain controls a lot of things. Just like in women too, we say that the brain controls the cycles.
Right.
Now, in a man as well, from a certain age, the brain begins to produce certain hormones in a particular waveform. All right. Now, these hormones will hit the testes. The testes, which is a powerhouse or the factory for sperms and hormones. Now, these hormones will hit the testes and begin to let the testes produce sperms.
Okay.
Now, these sperms, once they're being produced, need to attain a particular structure and form. All right. Now, these sperms, after production, will need to be stored in a particular place.
Right.
Mind you that God, in His own wisdom, makes the testes migrate from inside the abdomen into the scrotal sac, which is outside. The reason being that there's so much heat within the body. All right. So the testes that produce these sperms and stores them, if they are exposed to that amount of heat, all the structures there will be destroyed.
Okay.
All right. So God has brought them out into the scrotal sac, which is hanging outside freely and not getting that kind of heat. All right. Now, once these sperms are produced there and stored well, they have to travel.
We are learning.
They have to travel along canals in there and get into the major pipe, which we call the vas deferens.
Okay.
And then that pipe will now move along, go through a structure called the prostate, where other secretions will be added during ejaculation to nourish the sperms, as they go along the full journey. Now, the sperms will have to travel along what we call the urethra from that point, the urine pipe, all the way to the tip of the penis. Now, the penis will usually have to be erect during intercourse, go into the vagina and deposit the sperms within the cavity there.
Right.
Now, the sperms over there, once they get into the woman, they get energized with a little bit of warmth and then they swim. Mind you, the structure that we want the sperms to have is a head, a middle piece that has a lot of energy stored in there, and then a long tail,
like a tadpole.
which should be like a tadpole. Now, the middle piece gives energy to the tail to whip from side to side, and then pushes the sperm all the way to be able to travel. Now, a man could have problems with the production of hormones from the brain.
Okay.
2, the action of those hormones on the testes.
To produce
3, problems with the testes themselves, with the production. Problems with the storage.
Yes.
Problems with the transport of the sperms in there. And then problems with the structure of the sperms themselves.
Right.
So these are the areas where male infertility can be encountered.
Okay, so Dr. Bernard, let's come to you. So you got people who maybe have a problem from birth or something where they've always had a problem down there. And then people who somewhere along the line, they were okay, but then something damaged either their apparatus or the sperm or something like that. So for those who the damage came along the way, what do you find are some of the causes of that?
Okay, I want to pick it from where he talked about the heat. You know, the testicular or the scrotal temperature is about 4 degrees less than that of the whole body.
Okay.
Yes, and it's intentional. In other words, if you create a heat-like environment around the scrotum, then you are causing yourself damage. And I'll talk about varicocele in a moment, but there are certain acquired things which people do without knowing. For instance, if you wear tight briefs, which are dark, non-cotton, those things tend to trap a lot of heat.
Okay, so like silk or some synthetic fabric, some of those things.
Exactly. Cotton is the main thing.
Okay.
And it should be white.
Cotton and white for briefs.
And it shouldn't be tight.
Okay.
Yes. So those things tend to trap heat. Some people wear a lot of, like when we're in primary school and you're afraid that the teacher is going to beat you.
You wear your pea pants, before you wear your shorts.
Yes,
Okay.
that habit is not good.
Okay.
And those who like taking a lot of, hot baths, especially sitting in a bathtub. And then a common thing which people ignore, the laptop. Laptops emits
like
a lot
this
of
tablet
heat. No, this one is not.
This one's okay.
It emits a lot of heat. And then those who work in a very hot environment. Occupational
like
exposure.
And you have to wear overalls.
Glass furnace.
Yes.
What about athletes who wear like jock straps and all of that under their uniforms, like professional football players and stuff?
Those ones tend to be quite temporary.
Okay.
It's not continuous.
Okay.
Yeah. And then, so with this same heat tissue, there's what we call a varicocele. A varicocele, for instance, is when the veins around the testis gets abnormally dilated. Some of them, they come with, you are born with it. Others, as time goes on, the valves become incompetent. So the blood essentially pools around the testis.
Okay.
Blood contains heat, contains blood byproducts which are toxic to the testis. So it affects its function.
What about things that people consume, whether it's food or medication?
Well, once again, coming to occupational exposure, those who work in environments where there are a lot of, let's say, hard metals, industrial toxins, pesticides, and now even we are not so sure about how our fruits are, are being grown. A lot of things are introduced into our diets. Pesticides, for instance, all these things are toxic. And then some drugs also are quite, smoking, alcohol abuse, all these things are...
The abuse of alcohol.
Yes, quite toxic.
Okay.
There are some other... I'm talking about I talked about the varicocele, which are the dilated veins. The common trend also is poorly treated infections. Sexually transmitted infection, poorly treated. And it can affect anywhere along the tract that he described.
Are you seeing a lot of that in your practice?
A lot. Right from the testis to the tip of the organ. If the infection is not well treated. And some of them are so indolent, they can stay there for a very long time. Let's say poorly treated gonorrhea. 10, 20, 30 years can just be there, causing havoc. Yes.
Sometimes as boys grow up, they can acquire some injuries and even infections, especially around the time of puberty. You see, around the time of puberty, certain hormones produced from the brain begin to initiate how a man's reproductive system should actually work. So that's, for me, the time you have actually become a proper man. Now, around that time, where the apparatus is beginning to, let's say they are now commissioning the factory. If something goes bad that time, it can affect a man his whole life. Now, for instance, getting the infection we call mumps around the time of puberty is bad. Mumps is a viral infection that we call T. That affects. The same thing has a love for testes. All right. So your boys shouldn't be getting too close to people who have moms, especially around the time of adolescence. All right, because moms can destroy the whole testicular structure in there.
You know the name of the guy? It's called Nkobio.
Okpobio, yes. Okpobio.
When you see the person, it's like the person wants to smile, but they're not smiling.
They call it Jemreku too. Yes. So that's one thing. And then injuries that they get to the pelvic area.
Yeah.
Like somebody hits you there, contact sports and the rest. Those can also, affect the structure. And then you grow with it. Now, having said that, the infection bit, sometimes people will come to you and they remember having gonorrhea like 20 years ago. And then you examine and do certain tests and realize that the canals where the sperm should go through to collect are all blocked or damaged.
Oh, wow.
And then the tract where the sperm is supposed to pass, because of little adhesions, we said here before that gonorrhea, for instance, produces a lot of thick secretions, which if not cleared early, could lead to what we call adhesions.
Oh, okay.
And those could form little strictures or tightening of the canals. And so sometimes semen is not able to flow well. It happens so much so that in some people, when the semen collects and is about to come through the prostate, which is a structure that produces some secretions, there's a bit of obstruction, so the semen hits that obstruction and then flows back. And then it can go back into the sperm duct, but there's one big place it can go into, which is the bladder. Sometimes we are even lucky when that happens, because for me, my line of work, when that happens, it means at least the factory is working. Yeah. But the final exit where, the
so you can
distribution
at
point.
least we can take urine immediately after ejaculation and then centrifuge it and get the sperm cells that are there, harvest them, and use it for fertility. It's very possible.
So sometimes you harvest from the bladder?
Yes, we harvest from the urine.
Yes.
Yes, will.
Charlie.
God to make a way. We might not have a lot of time, but okay.
Let me touch quickly on the childhood injuries that you talked about. I mean, I had this patient who was riding a bicycle, the one with the crossbar.
Yes. He slipped and then...
He slipped and then... Exactly. And it happened around 10 years thereabout. He got married, no issue. So when he was referred to me because he couldn't pee. So when we did our analysis, we realized that within the pipe within the organ was narrowed. So straightforward, we had to do some plastic, cuts and join. And now they are very happy.
That's fine.
Yes. So those kind of innocent injuries could. And there's a very common condition to which affects teens called torsion, where the testes can decide to twist. Sometimes provoked, sometimes unprovoked. It twists, and that impairs the blood flow to the organ. Wow. And if it occurs for more than 4 to 6 hours, that means that testis is gone. And the interesting thing is that if it affects one testis, both testises, do communicate. Yes, there's something we call sympathetic occipitopathy, where one is injured and the other suffers collateral damage. So I always advise our mummies, our parents, that anytime your young boy complains about pain in the testis, sometimes in the abdomen, because he said the testis emanates from the abdomen. So they still do communicate with the abdomen. So the boy may have pain in the testes, but
it will be in the abdomen.
I'm like, I'm looking at him like the thinking of boys, the boys.
When boys are born as well.
Phone lines have been activated now, so you can call us with your issues, with your problems, your contributions, and your opinions. Just call us.
It's good to examine boys well, especially at the time they are born, up to 2 years. Sometimes you could have hidden testes. Testes that were not able to travel from the abdomen in there. So they get trapped along a canal or sometimes even within the abdomen. So it means that they don't enjoy that reduced temperature. They're still in there. And those testes, if you discover them later in life, will be of no use because they would have been destroyed. And it's even sad for certain cases, if it stays there for too long, then cancer development could also start.
So should your pediatrician do that, or do you have to take your boys to a urologist regularly?
You could take your boy to any doctor to start the examination. Now, if the doctor finds that one scrotal sac is empty,
Yes.
or the two are empty, then they will need to refer to the urologist. Having said that, in young boys, there is this reflex where sometimes when you touch their pelvic area or their thighs, you see that the testes are able to retract and go up a bit. That is not what we are talking about. You still find them within the sac somehow when you try and milk down. What we are talking about is an empty sac, and then sometimes you have to examine along the canal, and you might feel it in there, or an ultrasound may reveal that it's hidden there. It's also one of the reasons why a boy will grow up to become infertile. I want to just add this quickly.
Right.
We sometimes downplay the effect of stress on male fertility.
Yeah.
There are some men who overwork themselves. They're always busy, they're on their phone, on their laptops, they travel the world like back and forth twice in a week and all of that. That kind of stress sometimes affects the part of the brain that produces the hormones that will initiate sperm growth and formation. So most men who are very, very stressed and busy, who have a problem with fertility, should begin to, losing their schedule a bit.
Doc, we know the issue of, eating well, exercising, and doing all those kind of things. But I believe there are certain things that men ought not to do so that they don't create a problem for themselves around that region.
A lot.
What should they do? And you men who are watching out there, look at, lucky you. Lovelace just called. Because I don't know why. A lot of you are suffering, but you don't want to call the doctor and talk to them. Maybe you had an injury. Okay, Lovelace, good morning. Hello, good morning.
Yeah, my good day look very great today.
We thank God.
Thank you.
Can you hear me?
Yes, we can.
Yeah, please, you look very great today.
Oh, okay.
Thank you very much.
Yeah.
Thank you.
Yeah, please, I want to find out whether if it's true that your left testicle is bigger than the right testicle.
Okay.
Okay.
All right. Thank you for that question. Okay,
Thank you very much.
Doctor.
I'd like to ask him a question. How important?
He doesn't.
Okay, let's leave it.
Dr. Tobo.
Yes, there's just a mild difference in size, which
Okay.
is absolutely normal. What we have the issue with, what we have problems with is when there's gross disparity.
Okay.
If there's gross disparity, i.e. the left one is too small,
Okay.
and the varicocele can actually cause that. Too much heat
Yes.
around with the blood pulling around the toxins, affecting the function. Eventually, the testes may become
Really
quite smaller. So I think if he's asking his own question,
Okay.
he will
It is
need a
just
urologist
possible,
to
yeah.
Okay, so
to
Lovelace,
examine.
if like your right one is like Katia Boga size, and then the right one is like this apple here,
Then there's a problem.
then perhaps you should go and see Dr. Tobo at College or Dr. Senyo at Tantra.
Having said that, when you realize that your testes are so different from maybe your other counterparts, it's time probably to go and have it examined, or even you yourself if you feel that they're getting too big or too small, because sometimes.
Sorry, Solomon.
Sorry,
is on the line.
yeah.
Sorry. Solomon, good morning.
Hello, good morning.
Good
Yeah, thanks for
morning.
calling.
Yeah, I want to ask a question.
Go ahead.
Yeah, mine has been a chronic sickness. I didn't know because I was not having sex, but recently I've been experiencing weight gain, and then the diagnosis shows that sickness. It has been treated over a year yourself. Yes, sir. Because of that, I'm not able to have a sperm erection.
Okay.
You're not able to have a firm
Firm
erection.
erection. Okay. You said something was treated, but he's still in pain. Or
We didn't
I think you
quite
need to
get
go
that.
and
Yeah, you need to see a urologist.
You need
Okay,
to
so
go
yeah.
see a urologist.
I think I heard something about waist pain.
Waist pain, I had waist pain as
Yes.
well, yeah.
Sometimes when there is infection within the prostate,
Okay.
we talked about prostate being
Yes.
very vital in nourishing the spermatozoa, who are producing the semen and all that. We have something we call referred pain.
Okay.
Essentially pain in one organ being reflected in another part of the body. And the prostate infection can be a real bother when it comes to that. And it can affect your fertility and even your erection and ejaculation even as a whole.
So Solomon, to be sure, please go to college. We'll go and see Dr. Tobo, get an examination. Okay, but you know the way we women come to see you, gynaes, regularly. Should men be doing the same with their urologist, or do you have to have regular exams of that area, or is it when something isn't feeling right that you go in?
Let me take this quickly. I always advise my my male colleagues, junior colleagues, when you hit a certain age, don't take things for granted.
Okay.
Things shouldn't take you by surprise. You have to, one of the best birthday gifts you can offer yourself is a thorough medical examination. Especially since we are moving from is it HIPIC to
middle income.
He talked about people making, not getting times for them. I remember there was this particular patient who, for 4 years, no issue. And the problem simply was that he wasn't getting time. He gets to the house, he's tired. So sex once in 2 weeks. I'm telling you. When we did the parameters, everything was normal.
Okay.
So it's just absolute coital failure.
What is your problem? You
want to
spend
baby
time to
and
go
then
and money to marry a woman, and then you only do paracetamol like one a day.
So in the first year of marriage, actually, it is not only for pleasure, but it's also a job. So you do the job and make sure
and do it well.
Exactly.
4 in the morning, 4 in the afternoon, 1 in the evening.
No.
Let's talk to Abraham. Good morning, Abraham.
Good morning.
Thanks for calling, Abraham.
I appreciate all what you're doing. I always try to stick to your program.
Thank you.
What I want to ask is, my son he's 2 years now, but since he was born, and he always have this erection, and he's always holding his penis, and he's always strong. And sometimes he tell me he's paining him. And all the time, every morning, it's like always on erection like that, and it's strong, and I would like that. What's wrong with you? Leave that. Don't touch it. But sometimes you insist it's paining.
Okay.
He's always holding it, so I don't know. If that's
You have to take him to a doctor. Okay.
Yes, you need to take him to a doctor. There are a few things that will cross my mind. I thought I heard him say he always has an erection.
In the morning,
In the morning,
it's always strong.
in the mornings for every man. You see, your hormones, they play by time also. So for most men, around from
like
end of 3 a.m.
to like 4
to about all the way to 6. The hormones surge, will cause blood flow to increase. So I mean, people call it, I know if I give you this term, you guys will keep it.
Yes.
It's called early morning tumescence.
It sounds like tree.
Tumescence. Yeah, so and that is where the very popular sorry corpora comes from. All right. A man, no matter what happens the previous night, by this time would get an erection.
Okay.
And so we'll be able to give sorry corpora. Let me give you that to go and sweep with. Right. So it can happen in young boys as well. But there's one very important thing that we need to look at. If that boy gets an erection that lasts for a very long time, especially up to an hour, then there could be trouble. You see, the blood that collects inside the penile tissue, makes it very tense. And if it stays there for too long, could begin to destroy the delicate tissues. And so sometimes you might have to go and see a doctor because of priapism.
And he said
it says that it hurts. When an erection hurts, there's trouble. Now, the other thing is, if a child always lies holding the penis, it could be a sign of early infection that also needs to be looked at. So there are 3 things. The normal tumescence, the issue of a possible priapism, and then infection.
If you get blue balls, can that affect your fertility?
Let's talk to Precious and come back.
It's a legitimate question.
I know, I haven't said anything. Precious, we'll talk to him in car. Precious.
Hello, good morning.
Good morning. Hey, first lady.
Please, I want to ask, if a man gives you a sperm and the sperm always come out, please, what happens? Or what is the problem?
When he gives it to you.
Like
when he gives it to you, like in a jar, in a plate.
Not the plate, please. Ejaculates into
she said
hair
when he gives
and then
it
it
to
comes
you,
out.
and your man gives you.
No, so they're talking about sex.
Yes,
Yeah,
yes, yes.
I think she believes
she
that
said
the
if he
sperm should
gives-
stay inside. It shouldn't come out.
Wait, what?
Good. So after the act of sex,
doesn't know, yeah.
I mean, the woman shouldn't be in a hurry to get up.
To get up, okay.
Okay.
Yes.
That if you want to conceive.
Yes. So I mean, lie down for a while. I mean, naturally, once it's an exercise,
Yeah.
involved a lot of energy. After the whole act,
Yeah.
you rest, you relax.
But also, she shouldn't make the mistake of thinking that if some sperm comes out, you can't get pregnant.
No, no,
Exactly.
see, that's the
Yeah.
thing.
Because,
you see,
okay.
the vagina is a receptacle. And then there's a cervix, which is the entrance into the womb. It's very small. When the semen goes in there, because of the heat and the environment of the vagina, it begins to liquefy.
Okay.
Now, when it liquefies, the sperms now become free to be able to swim. And then they swim. The sperms are not only moving up against gravity, they're also being called by chemicals that are produced up there.
Okay,
All right. So they are moving towards something. And that's why they need that structure to be able to swim and go forward.
I hear
So
vitamin C would enable the swimming. Yeah.
E as well.
Yes,
Yes.
yeah, okay, right.
So
That's
they
one of my
and zinc
predictions.
too. They'll go through
Yeah.
and then swim up. But the water in which they are swimming, that water has no capacity to flow up, especially against gravity.
Okay.
So that water, once you get up, will flow out.
Okay, but the sperm is still
Because you see,
going.
the trouble is that I hear on TV and from herbal practitioners that when you sleep with a man and the semen flows out, then you, the woman, you have a problem. Your body can't take the semen.
Yeah.
It
It's
is
wrong.
it
It's a
is
myth.
wrong. It's a
Wrong,
myth
wrong.
and it's wrong. So people just have to take it. If you think there is a problem with the semen, go and have a test.
Okay.
But as for the water flowing out, it's not a problem. Sometimes we ask our women to lie down so that the receptacle keeps it there for the sperms to all free up and begin to swim up. But if immediately you get up, everything comes out, it's not a problem.
Okay. What's the difference between a sperm and semen?
Essentially, the semen is a vehicle, the water that is talked about, and then the sperm is contained within the semen.
Okay.
So what you see, the
Is the semen.
white thick, yes,
Is the
you
semen.
can't see
The
the
sperm.
sperm.
The sperm,
They're
but
too
it's
small.
in
Sperm
there
are too
somewhere.
small, they're within.
The blue balls.
The blue balls.
Yes. Can that affect your fertility? You guys are laughing. Meanwhile, the whole crew is full of men. They're all thinking, Shalina blue balls are dying.
But I heard
We're
a
all
woman
worried.
saying yes.
For the sake of
Mona.
our, what is a blue ball?
It's more like, what is that level?
Tell us what
Do you
the
want
blue
to
ball
know?
is. Yes.
You know.
I do.
I'm sure some of you have experienced it.
Okay, let me help Cookie. Let me help Cookie. You know, sometimes men say that when you let them get an erection and get aroused, and you don't let them penetrate or perform some sexual act that will make them
Yes.
ejaculate, then there's a lot of tension down there and their balls begin to hurt. Actually, it used to be a myth for a long time. You know, and I remember, Kuku, you like this question because when I was on Vodafone Health Line with you, you asked me this question.
Are you sure? I don't remember
The
this.
tips are
And you
there.
remember?
So, most guys would use this, to convince a woman to let them have their way.
Yeah.
But it used to be a myth. Recently, I've read certain things that says that when a man is aroused, indeed, there's a lot of tension down there. Blood flow, engorgement, and all of that. So, indeed, there is a bit. And after ejaculation, all of these things come down. So, it's part of the sexual arousal system. And there is no proof that if you don't have an ejaculation after getting aroused, you will get sick or you get infertile.
But after having that pain, like the tension you're talking about, that it hurts.
It's in pain as if you thought it before.
What we are much more concerned about are other possible reasons why the pain will persist.
Yes.
Okay.
And if it becomes protracted, that is when you need attention for it to be
What about
assessed.
holding back? When you never ejaculate, when you're about to, you just hold back. You're about to ejaculate, you just hold back. Does it affect the...
You do that a lot.
Holding back.
Holding back, yes. Not ejaculating. yes.
No, because the way
that
you're
is-
asking this
that is
question.
one of the solutions actually to premature
Ejaculation.
ejaculation.
Listen carefully, attentively, yes.
You know, so I don't think it's a big
It's a big issue, okay.
So you can hold.
You can hold and
Yes.
hold
Then
and hold.
hold.
And
Then
never,
hold.
never,
to prolong the
Then
yes,
back and
yes.
And what if
Okay.
you never ejaculate at all?
It's a problem.
Yes, it's a
If
problem.
you don't ejaculate.
No, I mean not that. No, not deliberately. You don't.
It's a
Anyway,
problem.
there are some people who
Yeah.
can, with time, they can train their minds not
Yes,
to
not
ejaculate.
yeah, exactly.
But if it is unintentional, and you're having sex, you get to orgasm.
Yeah.
Nothing comes out.
All right.
You have to be assessed.
Charlie, this
You have to
training
be-
is very
either
good.
either
It's
it
very
is
good.
going into the bladder.
Yeah.
Or
Hey.
yes, you have an issue altogether.
Okay. Look, everybody's on their feet.
Yes, all the
Everybody's
positions.
home.
I wish you could
Everybody's
pan through the studio and see all the male crew members.
So look, fertility matters are not a precept of the woman alone. The men also suffer it. So if you're a man and over a period of time you've not had a baby with your wife, go and see the urologist.
both of
okay?
you should go and get
see
checked.
Dr. Tobo at Kolebu, or
Yes.
go and see Dr. Senyo Mizrame. Okay, much love and peace.
From Koki and
We'll see you
Patrice.
tomorrow.
Blue balls.
Since the 15th